Ladies and gentlemen, welcome to our free webinar that organized by Dubai Quality Group, the Innovation and Organization Learning. Today, we have two professional international speakers, Dr. Raied Abdul-Karim, Strategic Program Director from UK Public Sector, and Dr. Nada Al-Moosa, Independent Change Management Practitioner and Trainer from Oman. They are joining us today. In this webinar, Dr. Raed will introduce the latest research on innovation and explain practical tools to help organizations develop innovation strategy and innovation system. Also, he will introduce a case study from the UK health sector that he recently led. Further, we'll have Dr. Nada will introduce a case study on organization learning in Oman that she was involved in and highlighting the key lessons and useful learning. Dr. Raed, you can start right now.
Okay, thank you. Just checking. Can you hear me okay?
Yes.
Okay, great. Thank you and welcome everybody, wherever you are. Good morning, good afternoon, good evening. The session, as introduced kindly by Dua, will cover innovation and organization learning. A little bit about my background. I have probably nearing 28 years work experience, most of which I spent in the UK public sector and few years in the private sector. I also worked in the GCC region, particularly in Oman, for about 7 to 8 years in the oil and gas sector. My background as well in terms of education perspective, I hold a doctorate in implementing IT-enabled change and realizing benefits. And I hold an MBA and a master degree in engineering. I'm very passionate about innovation and change management. And today this session is sponsored by the Dubai Quality Group. We work with this wonderful group very closely. I'm the chairman of the subgroup of the Dubai Quality Group, which is the change management subgroup. And we've been holding annual conferences for nearly the past decade every year. But last year, we were not able to due to the pandemic, and we've tried to do as many webinars and engagement sessions as possible. We are volunteers, we use our own time, our own resources, really driven by passion to help individuals and organizations, particularly in the Middle East. We are also affiliate of the Association of Change Management Professionals, which is a leading organization in change management. So really it is our effort trying to help others, and we're volunteering with our own time and our own effort. What I will take you through today is a little bit maybe hefty agenda, but I will try to run through so to give Dr. Nada, who we've been working together closely on this webinar, and we've been working together for many years around the change management agenda. So what I will be covering is a little bit of definition and the strategy evolution of innovation. I will talk about this theory, Ambidexterity Theory, and the innovator's dilemma, just a quick introduction into that. Then I will introduce a practical model that is used and well referenced called the Spoke model. And I will briefly touch upon kind of two case studies. One is called IDEO, which is an international recognized organization, and one that I've led recently in the UK. And then I will summarize. So that's what I will aim. And Dua, please keep me in check with the time in case I just get carried away. So without further ado, I'll just introduce you to innovation and what it means. A lot of you probably know the concept, worked with the concept, worked in the area of innovation. But if we go around the right-hand side, people describe innovation in many different ways. Some of them will talk about it and describe it as a new idea. And then they will say, oh, it's about a new product or a new service. Its origin came from a Latin word, which means renew or change. Hence, the link between innovation and change is very close. Further definitions or people trying to explore it more, they will talk about more concept. It's about more efficient, more productive, more reliable. And then we start getting, as we go to the left-hand side, a more rounded definition of what is innovation. So people start talking about it is actually solutions, and solutions are used to overcome old and new challenges. And when we start talking about that, we start getting closer to what is innovation is all about. And then it's a complex process. That's how it's get described. It involves commercial, technological, and cultural aspects in order to do innovation properly. And finally, it's probably the most recent definition or way of exploring it. It talks about value. Innovation is about creating a new value and capturing a new value. Maybe in some sectors we talk about return on investment or things like that, but it's very similar. It's creating and capturing value. So what's innovation is about? Successful innovation is about building internal capacity, capability, and skills, developing a business model and culture to support it. It cannot work in isolation. Having a new idea is good, wonderful, but it doesn't really realize return or value for the organization or the individual. Having a new product and services, unless it's commercialized, there's no purpose of it. So it's building the capabilities and the process really to do innovation properly. And it's about a concept which I will introduce a little bit. It's about developing the complementary assets and developing the whole ecosystem to make sure innovation is successful. So this is just to give you background of how people and organizations were thinking about innovation and how we slowly developing it into a more robust way. The next slide, this is how corporate innovation evolved over time. Started with very closed, centralized, proprietary way of doing innovation. This is my organization, it's behind a closed door, and they're trying to innovate. And slowly, this is in the 1800s, and slowly developed more and more into a corporate level approach, developing research and development labs, but still within the organization. So if you look at the left-hand side, it's about a closed system. If you like, on the right-hand side, which is effectively where we are now, it is more about open way, externalized and decentralized approach to developing new products and services that can be commercialized and to innovate properly. So organization moved between these two extremes into the merger and acquisition, where you've seen many organizations, successful organizations, trying to acquire or merge with companies that might bring new approach, new way of thinking, that might challenge their approach and methodology and brings a new innovation. To a joint venture where they develop jointly, share profits and equity, into the concept of incubators, where big organization more or less sponsor another organization and mentor them, help them financially, etc., to develop new ideas for them that they can use and commercialize. And into the more of accelerators, where big organization with systems and capabilities can sponsor smaller emerging organization, or what we call startups, and then help them with the resources, with the funding, and with the systems they have to make sure they innovate. And you've seen some other movements where joint developers on the net, they share a platform and they work for 2 days or a week jointly, remotely, to innovate on a particular area. So it's becoming more open, more decentralized. That brings different challenges in terms of governance and ethical values. But I'm just taking you through the journey, how strategies of innovation have evolved over time. This next slide is about something called Ambidexterity Theory. Ambidexterity or ambidextrous normally refers to a person that can use both hands very well, left and right. And from that concept comes the duality of doing things. And the tension between two concepts, exploit and explore. Exploit is about enhancement, is about development of things you already have to make it real. If you think about Apple, version iPhone 7 and iPhone 6 and iPhone 8, you think about this is incremental change. This is improvement to a product they already have. So that's exploiting. Exploring, when you come up with something radical, something very new that opens a new market totally. So for example, again, with the Apple, when they came up with the first iPhone, that was in the region of exploration, because that's a new smartphone, a new way of doing things that opened a new market and new customers. So a successful organization have to balance the two. Exploit is absolutely required because that what gives you the income and the money and the profit on daily basis, here and now. Explore is about looking a little bit to the future, taking some risks that will realize significant benefits to you. So that's what the ambidexterity theory saying. You have to balance these two, and you have to be mindful of these two areas in order to innovate and to grow. So it's kind of the incremental evolutionary change versus revolutionary and transformational change. So just keep that concept in your mind, and I will introduce you to something else, which is the kind of disruptive innovation or the innovator's dilemma. One of the most successful research being done in recent years is by a guy called Clayton Christensen. He's a very famous professor at Harvard. And he's done a book called The Innovator's Dilemma. I'll hold it up, see if people can see it a little bit. So that's his book. And that's really very transformational book, referred to by all scholars. And what it talks about, very strange phenomena when he studied it and published the book. And the phenomena said, there are many organizations that follow good management practice, but they do fail. Organizations that listen to customers on a regular basis, but they fail drastically. And they give many examples, such as Sears Retail in the US, which was in the 60s, 70s, a very big retailer. The DEC Mini Computer, Data General, and many others. So it's very weird saying, how come organizations that listen to their customers, follow good practice, they do fail, and why? And what they say, when you listen to your customers only and don't think openly beyond the customers, you will be confined to what the customers needs here and now, but not what they need tomorrow or beyond tomorrow. And that's where the explore comes in. And not every organization, we've seen, as I said, many big organizations fail to do the explore because they focus on the here and now, and they focus on enhancing their profit. Why do they do that? Because transformational innovation or exploration, it is normally developed in a small market or insignificant market. Hence, it does not realize value straight away. It takes time for the customers to understand the new offering and start to accepting it. And that's why this dilemma, and that's what this book refers to. It's not just about listening to your customers and satisfying their needs, but thinking beyond that. Partnering, for example, with open-minded customers to pilot new ideas and develop new concepts. And that's where innovation and exploration start to come from. Now I want to move to this, what we call the spoke model quickly. Spoke model, again, is very famous, developed by Tushman and O'Reilly. It's referenced in my doctorate research as well. It's about system, people, organization, and culture. To do innovation, you have to have these four different aspects. And they are very important to setting up the organization fully to innovate. So system is about routines, activities, the business model. People is about the ability, capability, and capacity. Organization is about org structure, working across boundaries and utilizing your resources differently. And the culture is developing learning organization, experimentation, and risk-taking. And putting these four elements together, set up the organization for innovation. I'll quickly take you through two examples. One is by an organization called IDEO. IDEO is probably one of the most famous organizations in innovation. They are expert in nothing. No, they are not expert in products or any product or any particular industry. What they are expert in the process design. So they innovate in that way. You can give them anything. And what would be useful, which I don't have time for, if you Google IDEO shopping cart, you will see very good examples of how this company innovate. And there are examples that I've listed here in terms of their innovation, from Nike sunglasses to Apple first computer mouse to many others. They apply the spoke model, and that's how they are successful. So what the key things they do when they look at the system, they set up their whole organization for innovation. They think about developing knowledge and ideas. They do loads of prototyping, and they do rough, ready, write process. What that means, they don't wait for their product to be 100% fit. 80% fit, they launch it and put it in the market. They learn from feedback, they refine it further. And in that way, they move on very quickly with innovation. The people, they use interdisciplinary teams, they use role-based on strength. Again, just to explain this, it's not about the senior person leading a team. It's about the person who's good at leading a team. They might be very junior, but they've got a special skill. Then they let them lead the team and do the work. So they base people and use people's strengths rather than status or seniority. They bring different perspectives. So that's how they use the people to innovate. In the organization, they have flat structure. Flat structure enables them to have a broad participation from their team, and leaders only intervene in critical moments rather than interfering throughout the way. They have few formal policies and procedures. As you've seen, sometimes individuals get suffocated by policies and procedures, and that limit them from innovating and thinking widely beyond their cultural boundaries. They are a flexible organization, and employees are flexible to move between different roles. They're not rigid in their structure. When there is a project or a new initiative and somebody in a particular team have specific skills, they allow them to move in between. And that way they harness and utilize their resources fully. And their culture is supportive, supports creativity. It's about collaborative working, learning from failure, which is very important, and encourages people to try and experiment, and encourage them to take risk, purposeful risk, obviously not uncalculated risk. So this is the ideal way of doing business. I think I'll skip these two. Now I'll just quickly introduce the case study with MyCare. MyCare is a program that I've led in organization which has 9,000 staff, 1 acute hospital, 13 community hospital. We closed the program about 4 weeks ago successfully. It's judged the best implementation in Europe, and we've gone live in the middle of pandemic. So we have to be very agile and change our strategy, change our training approach. And during that program, we've been given another project, which is to implement the program at a Nightingale hospital. And it was the first digital hospital in the UK that I was led this program. So this is a little bit about the program, if you like, some figures, just to give you a flavor of what it is all about. Hundreds of thousands of people reached out in social media. We have a team of 165 people. We have people and culture strands, which has nearly 50 people working in this, change, communication, engagement, which we valued a great deal and helped us with our success, and many other statistics that you will see. And again, I think thinking about it of why we were successful, we've used a lot of bespoke model principles for innovation. Some of the key things that went well and things that could have gone better, I've just highlighted in here, just being mindful of time. So I think I will give myself another couple of minutes because we started 5 minutes later. We've used iterative process. We've designed and tested with customers. We've used and exploit multidisciplinary teams that have doctors, nurses, managers, HR, accountancy, benefits people, change management professionals. And that way we were able to really develop the full agenda and a truly transformational program. On the other side, I think we could have been taking more risks to be more daring, but working in the health sector is very difficult to persuade people, as they are very risk averse, to convince them to take more risk. Co-designing with the organization rather than doing it as a program was very important to us. We introduced it late. We wish we've introduced it early to engage ownership. I just want to summarize. There's a lot I've gone through very, very fast. The successful innovation comes from really a complete process. It's about setting up the organization in a holistic way, as we've seen in the spoke model. the system, the people, the organization, the culture to complement each other. Think about all the complementary assets. And to give you an example, when digital images came, they did not take off until the internet provided the platform to share digital imaging more widely. And then the whole digital imaging exploded. So think about what complementary assets you need for your innovation to really for it to be commercialized and be successful. And then think about the whole ecosystem. You might need things like in the IDEO, if you look at the example, for example, they use organization psychologists to think about how customers think, how different mindset connects. So it's not just about the immediate technical people, and technical, I mean, it could be doctors, it could be IT, it could be anything, but it's much wider than that. So you need to think about that whole value chain and what is the whole ecosystem to enable you to achieve successful innovation. And finally, you can have new ideas, a new product, a new service, and let's create a new value. Unless that value is captured and realized by the organization, it becomes waste of time. So you need to bear that in mind absolutely from the outset. I'll stop here. I think I've talked enough, but sorry to run so fast in it. It's just the topic is very diverse and very complex, but I hope I've done it as much justice as possible. So thank you, and I'll stop sharing now and hand over to my colleague, Dr. Nada.
Thank you so much, Dr. Raed. Actually, your presentation is really a good intro to what am I going to go through when it comes to organizational learning. My background, I'm not going to talk about it much. It's not very much different than Dr. Raed. I am also from healthcare. I'm a nurse. I taught nursing for 10 years. I moved into quality management. I headed quality for almost 10 years. And this is how I got introduced to change management. And I was very passionate about it. And this is what made me go through doing research specifically in relation to organizational change. My focus is more on the behavioral aspect of change. So the people driving the new systems, the new processes, what is required from the people in order to drive change. My case today is very specific to health profession education. It's research that I was involved in, and it specifically focuses on how organizational learning is a very critical part in order to actually embed a culture of innovation in the organization. So just as a thought, since my background is education, I always wonder, and I like to start by asking if there is one thing you can change or would love to change in today's learning and education environment, what would that be? Let's think about the past year and all the changes that took place because of COVID-19 and the disruptive shift that happened. So what are the lessons learned from it, and how did people adapt or are still trying to adapt to all what's taking place in education today? The specific case study is related to health profession education. I'll introduce as background. Basically, we had diploma level nursing and allied health back here. And what happened is there was a plan to upgrade all the institutes to a baccalaureate level. So back in 2014, there was an upgrade specifically to the programs. So it was no longer a 3-year diploma, but they shifted to a baccalaureate degree. 4 years later, there was a royal decree to establish 2 main organizations. The Oman Institute transformed actually all the 13 institutions into one college, which became Oman College of Health Sciences. And then there was a higher institute specifically for health specialties in nursing. So it actually happened in phases. And between each phase and another, it was almost 4 years. Now, the purpose for this research was to
Dr. Nada, sorry to interrupt you. Are you sharing the screen from your end? Or do you
Yes.
want me to share the presentation, because we can't see your presentation, it's not on.
Oh, okay, let me stop and I will try and do that again. I'll go back to the first slide. Can you see the first slide?
No.
Okay, I'll do screen share again. Can you see?
Yeah.
Okay.
Yeah, yes.
Wow, I was already on slide 3. Okay, sorry about that. Okay, so I'll move on to, I was talking about the question changing, and the case was about health profession education. This is the background. So as I was saying, that there were 2 phases. First, we started by upgrading the actual program into a baccalaureate degree. And then 4 years later, once the baccalaureate degree was established, there were 2 organizations, Oman College for Health Sciences, and then the Health Institute for Health Specialities, which focuses on a higher diploma degree for nursing specialties in specific. The purpose of the study was to evaluate the nature of the change. So we were talking first about separate entities, and now they're all under one umbrella. So we wanted to really hear from the people, their background and their experience in relation to this upgrade. So you're talking from separate management into one management, one leadership. So we really wanted to identify what's happening on ground. What are the people requirements? So how ready are they, whether it's the organization when you're looking at systems and structure, or the people when it comes to skills and knowledge information. And the purpose is to come up with a change strategy and a roadmap to help people and the organization move together forward. So the study basically was in 2 parts. First, there was a survey that was distributed to all members of the organization, and we wanted to know what were the hindrances. So the survey basically had 9 domains, and based on the results from the study, if you can see at the bottom of the slide, the most hindrance people viewed in relation to moving forward with the change is information processing. And this was specifically related to once the decree was out, people were still not having enough information of what is going to be new compared to how we were practicing before. Where do people fit? What are the roles? And what are the system and process change? So it had to do with a lot of communicating this information. The second part was related to interviews with management and leadership in the organization. Why? Because we felt since those are the pillars of driving the change forward and helping the people move forward, we focused on, based on the highest 3%, which is information processing, organizational structure, and the human resource system. We wanted to know from leadership and management, how can we drive organizational change and how we can help the people move forward. The interesting results we found were in relation to 2 main areas, which is the organization readiness for change and the people readiness for change. And there were 2 main themes that came up. What were challenges or hindrances in relation to the organization? And based on that, what from their view they believe to be something that can have or building organizational capacity to move. So if you see, I highlighted in red because this was highest among leaders and management. They were really concerned about structure alignment. So for example, they were divided into different managements. So they wanted to know, how is this having being under one umbrella going to drive change differently? At the same time, they believed that leadership coaching was very important in building the capacity to move. So this is bearing in mind that in order to lead change, you need to understand and have a mindset of change. The same happened when it came to people. So the challenge, the main challenge was related to people's mindset. People got used to literally over 20 years doing the things on separate management perspective. So everybody had their own dean, everybody had their own director in relation to their specific institution, and now suddenly you're reporting all under one umbrella. So it was really a challenge and very difficult to move from that mindset of doing things differently. And the other interesting thing that came up in relation to building people capabilities was psychological safety. And this is where linking learning organization and innovation comes in. So if we want to allow people to practice new ways, because we came up with a different structure, and that means there has to be a different way of moving forward, a different way of thinking. People felt, I need that space. And this is how we thought starting should be. So starting small and moving upward, it's about providing the space for people to think in a different way, and understanding that with this new thinking comes experimentation. So if experimentation is allowed, innovation does not only come with the end product, but innovation comes with a new way of thinking. And the new way of thinking means it's not only one person, it's building from that one idea to someone else, shifting it to a department level, and then more to a holistic organizational level. So what are the things to focus on when we are looking at how can we implement a culture of organizational learning, knowledge, and innovation creation? It's very important to understand, and I think Dr. Raed mentioned this earlier, that innovation involves different elements and they have pillars. So you're looking at systems, you're looking at people, you're looking at a culture. So it's a continuous process. Learning through experimentation, connecting learning to learners, and building collaboration of relationship. And when I'm considering relationship here, it's not only about internal relationship, but what's happening also outside and what can I gain from external thinking. And this is how you bring about building organizational capacity for change. And obviously, change drives innovation. So if I want to look at it as holistically, it's very important when we are considering organizational learning and innovation being part of it, it's about purpose and value. And again, I would go back to what Dr. Raed was talking about, having shared value. And that shared value should be in relation to where all, as an organization, holistically passionate about that purpose. So in this way, you're building a culture of learning and innovation. And it's very important also to understand that this involves risk-taking. So accepting uncertainty is important. Accepting that failure brings about learning is also important. Accepting that this is part of the process. And understanding that we have to be open to people bringing in new ideas. This is how you bring in new thinking. And this is how you are shifting your current strategy and aligning it to your future vision for the organization. I hope this actually did not take much time. And this, you can actually see how a learning organization is very much related to bringing about innovation from a holistic perspective. Thank you very much, Dua. I'll leave the floor to you if there are any questions to take.
Thank you so much, Dr. Nada, for your presentation, and thank you, Dr. Raed. Right now, we are waiting if there is any questions need to be answered. Actually, we have a feedback or comment from Mr. Zach about McDonald's is still going strong and so many series failed due to culture of disengagement of reality.
Yeah, so ZARS is actually, I agree. They failed because they ignored the discount retailing, and that the discount retailing stripped a lot of their profit, and they were not mindful of that. And as a result, they've lost significant market share. Any other questions?
I'm waiting for the time being. Only another comment from Mr. Zak as well. New innovation are drying up in MENA region, from food security to food supply chain to climate change issues to water stress and water supply chain. Why not we focus on of pressing demands and create supply? This is a question from Mr. Zak.
I mean, there are many modules. The demand and supply is one module of many. There's open innovation and others. But the demand and supplies is, I get two different perspectives. One, organization thinking about, let me develop a new product or services and push it to the market. And that market will eventually develop the need for these new services and new products. And some people do innovate in that way. Others will go the other way. We're looking at the demands from customers and work with customers to say, what is it you need? What kind of features or product or value you would want? And they innovate in that way. So that's one approach of doing it. There is also the classic innovation, the open innovation, and what we call the push-pull innovation, which is supply demand. And that's one way of doing it.
We have another question from Mr. Krishna. He's asking about, is an incubators, what role an organization can play?
So sorry, I didn't get that. What is the question again?
We can't hear you, Da.
Okay, Mr. Krishna is asking about as an incubators, what role? Yeah, what role an organization can play?
Well, I think there's key things. This is quite a tricky area for incubators. Incubators is when you see and you imagine an organization that have products, services as a value aligned with your organization, and you sponsor them in order to accelerate the innovation for your organization. And there are many things you need to think about. Usually, if for a large corporate organization, you will see a tension after a while, because these organization that you incubate, they might have different approach. They're probably more risk-taking, they break rules, and they work differently. And that usually clashes with a very large organization with system, processes, procedures, and a certain momentum. So they need to, you have to select very carefully what kind of organization, a startup or an organization that you want to incubate, what their value set, and how you can adjust internally to make sure you both succeed.
Thank you, Dr. Raed. Another question from Mr. Muhammad. What are the first steps to take in order to succeed in innovation? Dr. Nada, do you love to answer this question?
I think, as I was mentioning, when we did the research, it's very important first to see the interest. So sometimes you have groups that really have those interests. So getting a couple of brains together, this already created a different way of thinking. So once upon a time, I believe we used to look at innovation as a new product. But if you're looking new as the concept of new, it's not only about a product, it's also about new way of thinking. And not only focusing internally, but looking at what are the external variables. Another thing that I believe, and this is based on the research we found, is that people really need to feel safe that it's okay to take a risk. And it's okay that it didn't work the first time around. I mean, if we look at historically, how many innovators failed, not hundreds of times, but thousands of times until they got to what they wanted to. And this is why I mentioned it's a process. So from one process to another, you're building learning. So imagine if it's duplicated, not from one person, but from a couple of people. So you are actually having an effect that's moving from one to another. If you are an organization that builds a culture that it's okay to take risks. Now, I'm not talking about major risks that you're going to shut down the organization, but you have to measure what is the percentage of your risk you're wanting to take and modeling that. So I don't only say it, it also starts from a leadership that has that kind of mindset. And this is another thing when I was mentioning that one of the biggest things is moving away from the mindset that it was always done this way. So allowing risk-taking, which means psychological safety, has to be there in the organization, and allowing that if it failed, we look at it as learning. If you remember the slide Dr. Raed had, there was a part that said, what if? So this itself was a learning process for them. So I believe, honestly, risk-taking, starting from the purpose, shared value, is very, very important to move forward with it. I don't know if you want to add anything to that, Dr. Raed.
Maybe, thank you, Dr. Nada. I think maybe one thing practical to do, if you follow a structured change management approach, and I don't know if our colleague Khalid Al-Mubarak is on the call, but there are structured approaches, and ADKAR is one of them. So what that suggests, the first approach might be is raising awareness in your organization. Actually, innovation brings value, create value, and support organization growth, and then move into the next step of creating the desire that the organization really having the right mindset. They want to invest, they want to set up the whole system for innovation. And that might be practical steps of starting with that.
Thank you, Dr. Raed. Thank you, Dr. Nada. Backing to the issue of mindset, as Dr. Nada highlighted, we have a question from Vinayak. He's saying, do you agree that first we need to change the mindset in the organization before going for innovation?
Well, honestly, yes, because it's not a matter of if innovation is, again, is a way of thinking. So, and changing mindset, we have to accept as human nature, it's gonna take time. So I'm not gonna come one day and I say, I'm gonna have a hackathon, for example, which many organizations do, or a think tank, and bring a lot of brains together and then stop there. So again, if we look at change management, how do we sustain that? Mindset is going to take time, but there has to be a place where we start. So if you remember the slide where I put two heads together, if you see even one step further, this is going to make at least people aware that there was a movement forward. And one mind building another will build a department, and you will, honestly, if you look back, you will see that mindset change. But remember, it's not something tangible. So unless you have a measure tangible to see that this is an effect, this is how you're going to build the culture, and this is why it's a process that's phased out.
Thank you so much, Dr. Nada. We have a question from Mr. Muayyad. What is the role of data in healthcare innovation? Dr. Raed, I think you'll be able to answer this question.
I mean, data provide information that provides knowledge, and that's normally is the basis for us of making decision. And you can innovate a great deal around data and how you use it, how you gather it, how you make sure it is not a threatening, but is actually an empowering tool. So it has a big part in enabling innovation. In research and development. Remember, research and development develops knowledge, and innovation uses knowledge to innovate. So it's the basis for innovation.
And if I'd like to add also, unfortunately, it's not used enough. So we have a lot of data over there outside, very sadly, but the use of it to move forward is not as fast as the innovation itself. So you're having a lot of things coming up, but the use of these things is not as fast as developing them.
Yeah, that's an interesting point, Dr. Nada. I think the other things in terms of data, thinking beyond the traditional form of data, if you think about lessons learned, how many organizations actually repeat the same mistakes because they haven't looked at lessons learned from previous organizations and applied them? So data can be used in that way by looking at historic failures and learning from them, and developing a learning organization is a very important step for developing innovation as well.
Thank you. We have another question from Ms. Nada talking about the innovation in education. She's saying the innovation in that field facing a lot of colonization of it or barriers. So she's asking, what do you suggest to break this barrier?
Dr. Nada, this is your field.
Yeah.
What do I suggest? Okay, the list goes on, but let's say, for example, I was recently reading about many things that are taking place in education. There's always a place to start. So if we go back simply as research, we're all familiar with ResearchGate. So there's a lot of research happening over there. This is a place where scientists and researchers get together to see what's the latest that's happening out there. Breaking barriers by, you need to start somewhere, whether it's an organizational level or a department level. I will speak about my personal experiment that happened, and when we decided to bring about change. There was a lot of struggle, and there was a lot of mindset of, why do you want to bring this, we've been doing it that way, it's just more paperwork. And what's happening is, what we decided is, there were a few people that came and they were interested. So for me, this was my start point. Sometimes you do something, you don't talk about it, a result comes up, others see it, and then this is how you're going to create interest. This is one way that we felt we were able to break a barrier. Now, is it all gone? We're talking about now 2021? No. I'll have to admit that we still had challenges, even as of now that I'm speaking. But it started somewhere. It started by an interest driven by people felt, yes, this is the right way to do it, let's move there. So if you can even just get one or two people to consider it and work with you, and it doesn't have to be internally, even from outside, but the minute you get a spark of a result, this is a way to move forward. It's not easy. Many other places, for example, as I said, they have hackathons, they have think tanks, they have innovation center, and this happened in education. Some well-established educational organizations have innovation centers that is not only internally, but they collaborate with others to bring about internal change. So always external collaboration is a way of bringing about internal change. I hope that helped.
Thank you, Dr. Anada. We have another question from Mr. Krishna. He's saying, how important is awards and recognition for innovation? And what should be the right reward and recognition system to the innovation?
So I think it's, so innovation recognition is always good. If you think about changing mindset, which is a concept I talked about and Dr. Nada talked about, it's an important first step in getting organization to work innovation. Recognition is really starting to reinforce particular behaviors. So if you have, for example, I'll give you an practical example when I used to work in the oil and gas sector, where people who comes up with an idea and they encourage this, a new innovative idea, they get recognized. People who their idea develops into a value, and that value get realized by the organization as a profit and return, they get a bigger recognition. And that way you start reinforcing the right behavior. People should start thinking beyond the box, should start thinking laterally, should come up with ideas, should start taking some risks, and that will create some internal momentum. So it reinforces positive behavior. Similarly, recognition could be used as well to discourage certain behaviors. So to me, it's very important, part and parcel. As a human being, we like to be recognized for things that we're doing, and its impact can be wider on colleagues and departments to encourage a particular behavior or a particular approach.
Thank you so much, Dr. Raied Abdul-Karim and Dr. Nada Al-Moosa for joining today and give us some time from your busy schedule for this webinar full of fruitful information about innovation, and looking forward to see you again in another webinar. That was the last question we have, but I think we have another question from Ms. Aida. What are the main leadership behavior and skills that encourage innovation initiatives in any organization?
I think I've touched upon quite a few in my presentation in terms of the learning organization, in terms of risk-taking. We talked about recognition and support, but above all, leaders need to start, if you think about the spoke model that I've introduced in setting up the organization with an innovation system, being able to encourage people to experiment and prototype, making sure there is the concept Dr. Neda talked about, psychological safety. They are safe to experiment, they are safe to learn, and that way will encourage people to innovate and try new things. So there is a lot leaders can do in setting up the internal system, the environment and the culture as leaders to help with innovation.
So we are at the end. If you would love to say or to add anything, Dr. Neda, Dr. Raed, before we closing the webinar. Dr. Neda?
Thank you so much, Dua. I hope this was learning for all of us. It certainly was for me. And thank you again for Dubai Quality Group for this opportunity. It was really nice when we were sharing the ideas and brainstorming, myself and Dr. Raed, and how it was, very interesting to link learning organization with innovation. So thank you for being here, and thank you very much.
Yeah, same from me. Thank you for Dr. Neda. We worked on this collaboratively. Thank you, Dubai Quality Group, for the sponsorship, and for you, particularly Dua, for all your support with the marketing, social media, and for coordinating this session. So thank you very much. And thank you all participants for joining us. I hope you found it useful.
Thank you, everyone, and looking forward to meet you. We're gonna organize a monthly webinar dedicated for our subgroups, especially for change management subgroup. Each month we will have a free webinar. Thank you, everyone, and have a lovely night. Thank you.
Thank you. Thanks. Take care.